Hi, everyone. Welcome to our next session of Public Health 101. Today, we're going to be hearing from the KidsNet and RICAIR program. And Janet, you lead the program, correct?
I'm the Provider Relations Manager, yes.
Perfect. So we're going to be hearing from her today. If you have any questions, feel free to put them in the chat, or at the end, we can use the raising hand, or you can just unmute yourself. All right, Janet, go ahead. You can introduce yourself and you can get started.
Okay, great. Well, thank you everyone for joining today. As Jennifer mentioned, I lead our provider relations team for KidsNet and RICAIR. KidsNet is a system that has been in place in Rhode Island for 25 years. The program started in 1997, and it is a health information system. So what that means is, I'll go back in time to that point in time, and what was occurring was a measles outbreak, very much like the COVID outbreak. And the federal government asked every state to develop an immunization registry. And the powers that be in the state at the time thought, well, let's branch out on that idea and include other preventative screenings in our registry, and KidsNet was born. In 1997, beginning January 1, every baby in the state of Rhode Island from any of our birthing hospitals is automatically entered into KidsNet from their birth certificate data. And what I'm going to show you today is our training environment. So we won't be looking at live children, but a simulation of what our provider offices get to see. So I'm going to share my screen. Okay, so Jennifer, can you see my screen?
Yes, you are good.
Okay, great. So this is where we're going to log in. Every user to our system is provided a unique user ID and password, and that is depending on how they're going to utilize the system. So as I just mentioned, I'm going to log on as one of our primary care provider offices, but we roll KidsNet out on a need-to-know basis. So what that means is there are other agencies and other authorized users within the state, and they are provided access to information on a need-to-know basis. So, for instance, a provider's office is going to see the information that I'll show you today, whereas a school nurse's office, school nurses needing to register a child for kindergarten or making sure that they're vaccinated appropriately, they have access to only the screens that they need, which would be the immunization page and the lead screening page, because children should be screened appropriately for lead as well. So they are allowed access to those two program pages. So to continue on to access the information, the user has to agree to the terms stated here on the login page, that of course the information is confidential and that they'll abide to all of the state and federal laws. And we do monitor the site, so they are aware of that, and user IDs and passwords should never be shared. So we're going to agree to those terms and log on. So here, as I mentioned, I am a primary care provider's office, and I have the ability now to use the system to search for any individual that might be coming into my practice. So I can use the system to search for my own patients or anyone new. And the benefit of that is if I have 3 children and I'm going to now transfer from, let's say, East Greenwich Pediatrics to practice in Woonsocket, but the practice has not yet forwarded that information to the new practice, that practice in Woonsocket can search for my child's information. So I'm going to do just that. And if the child's name is, let's say, Sid, and I can't quite make out the spelling of the last name, not to worry, I'm going to try a few tricks. So if I put in Sid, not quite sure how to spell that last name because I can't make out the spelling on the paperwork, I can pop over to my date of birth field and I can pop in my date of birth for the child, which was 1/13/2000. And searching on just this information, I may be able to locate my kid. The other sources for search that I have available would, of course, be the last name or the parent guardian's information, or, of course, the unique KidsNet ID number that is assigned at birth. So I'm going to search, and lo and behold, darn it, I don't have anybody that's coming up that way. Well, I forgot to put in my little trick, which would be an asterisk after the D. But to really show you the benefit, if I come here and I just put in 0113, I just realized I put in the, that's why he didn't come up. Forgive me. I'm going to go back and put in Sid and search. Here's my kid. So now I know that Sid, if I look here, the information I have available is that unique KidsNet ID number that was created at birth. I know how old he is. I have his date of birth, his mom's maiden name. All of this information was collected at the birth hospital, which of course is listed here as Women and Infants. The last known insurance carrier is listed. We have an agreement with the major plans in Rhode Island that send us data concerning their enrolled members on a monthly basis. So we have that information available as well in KidsNet. The current primary care is listed, and others that have immunized the child are listed. We consider the primary care provider to be the last primary care provider who immunized the child. So that is how we recognize that relationship. I'm continuing on to see parent guardian information, and this language spoken in the home is collected at birth or from perhaps some of our other agencies if we have that information, and the most recent addresses that came along with the data that was supplied to KidsNet. So now I want to search for some information regarding SID. The best place to start would be coming over to my newborn summary. So we like to start here because it tells me everything that happened in the birth hospital that is pertinent to a primary care's office. So if I click on the newborn summary, it gives me a nice display of all of that pertinent information that the doctor may want to know. So remember, he's 2 years old now, but coming in as a new patient, it's really important to know that he was a preemie if I don't have that additional documentation from the previous provider. So I do know that he was administered the hepatitis B in the birthing hospital, which is routine. But another important note here is telling me that he had some issues with his hearing assessment at birth that all babies are tested for. And we have the recommendation stating that he needs a specialized test because of a medical condition. That medical condition being that he had a lengthy stay in the NICU. And sometimes when you receive certain medications, when you're a preemie, that predisposes you to hearing loss. So we would want this baby to have specialized testing further along. So the other information that's available to me is the result of the newborn developmental risk assessment. So this again is an assessment that is provided in all of our birthing hospitals to every mom and every baby. This is an assessment done by a nurse. The nurse takes a look at mom's chart and baby's chart, and they determine from that information as to whether the family can benefit from a home visit. And in this case, they're determining that there is a health issue with the parents and perhaps a demographic risk factor present. So they are going to make that referral over to the Community Care Alliance home visiting agency. So of course, this all occurred from the birthing hospital. And the newborn screening is telling me that all conditions were normal for the metabolic screening. So many of you may not yet know what that means if you're not parents yet, but when a baby is born, just popping on this page now, we can navigate right from the child summary page by clicking on the program name, or we can navigate from the left-hand menu. But the newborn screening is going to show me that the little pinprick of blood that they take from the baby's heel and send it off to the lab, they test for conditions such as everything listed here and over and above those that are listed here. But the most familiar to you might be cystic fibrosis, PKU, which is included in the amino acid disorders, but a multitude of screenings take place from that one drop of blood. And if identified, they can then recommend medical treatment for that baby. So we use KidsNet to ensure that every baby is receiving this newborn screening, because their results are entered into the database. So now I have looked at my my glance, if you will, at what happened in the birthing hospital. But now remember, SID is 2. So now I want to see the most important piece of information generally to a primary care provider's office would be the immunization page. So I'm going to click on that first, and the immunization page is going to show me if he is up to date on his immunizations or not. And we are spinning, so we should get there soon. Okay. So here we go. Now, KidsNet, until about 2 years ago, only included children until they turned 19 years of age. So what I mean by that is providers were only submitting data regarding immunizations for their patients until the individual turned 19. And up until that time, we did not have an adult registry. We passed legislation, thankfully, to include all ages in our registry, and that's when the name RICAIR was born. So we think of the immunization page within KidsNet as RICAIR because, of course, we couldn't continue to call the immunization information system, IIS, that sits within KidsNet, because now that wouldn't really truly apply to adults. So RICAIR stands for Rhode Island's Child and Adult Immunization Registry. So that's where this name comes in. So I am now going to look at SIDS, immunizations. The primary care is Woonsocket Thunder Mist Health Center, and the wonderful thing about the immunization page is now, remember, I'm the new doc. I don't have any information on SID, but I can see that according to KidsNet, he is only due for hepatitis A. And this is based on the ACIP recommendation, and of course, this is also based on the information that's available to me through KidsNet at the time. It is state law that all immunizations given to individuals in the state must be reported to our immunization registry. So the other handy dandy tool that providers have is if they want to see a little bit more about that certain type of vaccine. So if I come over to this first dose, it tells me where that dose was administered. So it's telling me that the dose came from women and infants, that the lot number is provided, and the date it was created or sent to KidsNet. So how is data sent to KidsNet? If the provider's office is utilizing an electronic health record or EHR, then they utilize a system called an HL7 interface. So they enter their immunizations directly into their EHR, and depending on their vendor, and by vendor I mean not every single provider's office uses the same EHR system. So some might use Epic, some might use eClinical or another system. Depending on that system, they may submit that data to us in real time, or it may come to us every evening, or it may come to us by a manual process where the provider's office has to go in and actually send the data through their system. Most of our provider offices are utilizing EHRs and sending their data electronically. We do have a handful, and by handful I mean about 20 providers who still submit their data to us on paper. And we have a data entry team that enters that information into the system. So we have features available if this child needs to go to camp or to daycare and the provider needs to print this information out for them. They can utilize this print screen feature and it prints that out for them. So he, of course, is not due, or she, rather, Sid, is not due to enter kindergarten. But when that time comes, you can see, of course, she has not met any of the school entry requirements. But if I hover over the X, it tells me what those vaccines will be that she has not yet had. So now I want to look at some of the other information available for Sid in the system. And my next place to go would be the hearing assessment, because if you remember, Sid had some issues regarding the lengthy stay in the NICU. So I'm going to pop over and look at the hearing assessment. And it's repeating what we already know, that the NICU stay was greater than 5 days. And so I'm a little concerned because Sid has not yet had the follow-up testing that she should have had. And the reason I know this is because the pediatric audiologists in the state are entering their results directly into KidsNet. So when they see a child that's at risk for hearing loss and they follow up, they put their results directly into KidsNet, and those that have the access to see that information would be able to view the results. So I'm going to search for another child that I know does have a follow-up so you can see what that looks like. So I'm coming to my patient search page again, and what I'm going to do is search by KidsNet ID number, because if I have that available to me, I can also search in this manner. Okay, so now I have Violet, and you'll notice on the left-hand menu, Violet has some options available for me to search on. She is 17 months old. She does not have any data in lead poisoning or early intervention because there's no data to be seen in that page. So I'm not even able to click on it. But if I come down to hearing assessment, I know that there's data in that program page. So if I click on it, here we can see she had several tests in the newborn screening process in the hospital. And they are recommending that she have a diagnostic ABR. And this is where I can see that detailed audiological diagnostic information where the child Violet did go on, she received that further testing, and now as the primary care provider, I have access to it and I can see that the audiologist is recommending that she be reevaluated in 6 to 12 months. So I have that information available to me. So I'm going to jump around a little bit from kid to kid so you can see what some of our program pages look like, because not every child has data in every page. We do have some information on Violet, however, in WIC. So if a child is participating in our WIC program, that information would be made available again to certain authorized users depending on their user ID. I'm logged in with a primary care provider's user ID, so that would be important for them to know the WIC information, mainly knowing the certification date, the last visit date, the height and weight of the child at that visit, and if they ran any blood work, that would then also be made available to the provider in regards to the hemoglobin and hematocrit levels and the risk factors as to why the child is enrolled in WIC. So I want to pop back to Sid for a moment, and I'm going to pop in that number. Okay, so we saw that this family was referred for a home visit with one of our family visiting agencies. So I want to see a little bit more about what that visit or visits entailed. So here I'm going to see that the child was referred to our First Connections program, and our First Connections program is, in most cases, a 1 to 3 visit program where a nurse would go out, and in this case, we can see that agency is Community Care Alliance. And we can see a little bit more about what happened at those visits. And what I mean as we being find the primary care provider. So if I scroll down, I can see, now remember this baby was a preemie, so this would warrant more than the 1 to 2 or 3 visits. If I click on the first visit or all of these tabs, I can see what occurred at each and every visit. So if I click on 10-2, I can see that the referral source actually came from the OBGYN, and the content of the visit is making sure that there's family and maternal well-being. They offer financial and emotional support and social support, so that nurse is really going out and not only providing medical care, but also referrals to community agencies. So then if I continue on and maybe I want to look at this visit date, again, the referral source is OBGYN. I'm getting a little bit more of the same, but you can see just by clicking on each tab, I can get a bit of information as to what occurred at each visit. And then we have the referral source coming from level 1 and the content of the visit ultimately here. So I just wanted to point out that's what you could typically see in the family visiting program. There are longer term programs that are offered by that office of home visiting, and one would be a Healthy Families America program, where they connect with the family before the baby is born, and they'll work with the family until the child turns 4. If that happens, the referral generally will come from the First Connections agency, or anyone can refer, meaning the OBGYN's office or the pediatrician's office. And it's a great program because often families might need more than a 1 to 2 or 3 visit, and they really will do their best to make sure that that family is set up with the needs that are pertinent to what is going on in their family. So now I want to show you a little bit more about one of my favorite programs in KidsNet. So I'm going to pop over to search, and coming here, we're going to look at another Violet, but she has a different last name. And okay, so here we have Violet, and again, all of that information is made available, but I want to look at Violet's lead screening. Now, Violet's 2, and she should have been screened at least twice by now, and that is because children, according to the Rhode Island regs, and that follows CDC's guidance, should be screened at 1 year of age, beginning at 9 months, generally happening at the first visit, at the first year visit, 12 months. And then again at a year later, 2 years of age, but at least twice with a blood draw in this sample type we can see here, meaning a venous or even a finger stick, would constitute, of course, a blood draw. And we want them screened twice before they turn 3. So Violet has been screened twice, and in fact, that first screening, if we look at her date of birth being 12/21/2019, she was screened just a little bit early, but thank goodness she was, because she has a lead level of 11. Now, the acceptable range for lead in to be available in the body, if you will, is actually 0. But the EPA and the CDC have stated that anything above 3.5 is considered elevated. So at 11, this is going to be very concerning. So what happens when a child has an elevated lead, they are referred to a lead center in the state, and they're also, depending on the level, going to be referred or offered a home inspection. Now, this is exactly what happened with Violet. We have the inspection date as to where they went out to the home, and the first inspection date is listed here. The results are listed stating that the hazard is both interior and exterior, and the address that was inspected. So if you see here, it's very interesting because the first inspection date was 3810 Main Street, and she was screened again on 3/17, although she should have been screened within 3 months, because when a child has an elevated lead, we want to make sure that they're screened every 3 months so that we can monitor that that lead level is coming down. So this is in fact very late for that second screening to have occurred, but we have a different inspection address. So you might think, well, you're in the training environment and this isn't typical, but unfortunately it is. There have been identified hundreds of children who have elevated lead levels in Rhode Island. So as I mentioned, no lead level is safe in children, and When this is identified, families will receive a letter stating that your child has an elevated lead level, and that repercussions of this could result in behavioral issues, learning difficulties, or other health issues. So it is a serious matter, but we do have the results of every screening that every child has available in KidsNet. Now, we need to, of course, make sure that children are screened. Now, we saw our other child who was over 2 that didn't have any information in that program page. Well, that's simply because they have yet to be screened. And we do have tools available to our provider offices. Now, remember, I'm logged in as a provider. If I come here to my practice reports, this message is going to come up and asking me not to download any sensitive data onto a personal device. But if I come here and I want to look at all of the kids in my practice who have never been screened for lead, I can easily look to see who those children are. So I would come here to my practice report and I would plug in. Now, if I want to look at all of the kids who are eligible to be screened for lead, I would come here and put in 12. And we want to make sure that kids are screened or monitored for lead poisoning until they turn 6. So I'm going to go up to 60 months just to see, and you are going to be very surprised at the number of children. So if I generate report, I have 345 children in my practice who have never been screened for lead, not even once. So they could be walking around with an 11 like Violet and not even know it. So what we would ask the practice to do is make sure that at their child's next physical that these children are screened appropriately. Other reports that we have available for the providers would be, well, you've been screened once for lead, but you need to be screened a second time. This report will identify those kids who need a second lead screening. This report is going to be easy peasy and tell me, well, of those kids who have been screened, who do I really need to worry about? So I don't need to put anything in my data fields. I can just click generate report. This is going to allow me to look to see, well, who are those kiddos that I really have to worry about? Now, this is not typical of one single practice, but with a large practice, especially because we've recently, not we, but the EPA and the CDC have lowered the acceptable range to 3.5 from 5, we're going to have more children that are identified as having an elevated lead and are going to need follow-up. So on our report now, I can see that I have 58 children who have an elevated lead that need to have some follow-up, another lead screening. But the nice thing about this report is I can also look to see my very concerning kiddos, like a 19, and it even tells me the date that they were last screened. So this is telling me the date of her last screening, Lenny rather, and he has not been screened in over a year, and we need to get on the ball with Lenny. So that's one way a practice can utilize this report. Other reports they have available to them would be how many of my children in my practice are up to date with COVID? So if I click here on my COVID immunization report, this is going to show me, if I wanted to focus on a certain age range of children, I can, or if I wanted to run this for my entire practice, again, I just click generate report. And this is going to show me the COVID immunization status, if you will, for all of my children. So I have never had a dose due in the future. But if I continue on, looks like I'm not doing very well for my kids. So we're going to run this in a different way. If I click here on immunization report and I come to, now remember, they shouldn't receive this until they are over a certain age range. So I'm going to even begin to give allowance. I'm going to start at, let's just focus on our older kids from 5 years. I can change this to years, and I'm going to go up to 12 years. I want to see how well I'm doing in that age group. And generate report. Still, yikes, well, still never had a dose, never had a dose. So rather than looking at all of these kids individually, I know that I have some work to do with my COVID vaccination campaign. I can look to see immunizations submitted to KidsNet and or RICAIR by other providers, meaning that if my kids in my practice were immunized elsewhere within the last 2 months, say, so I'm going to put in 05, 01, 2022, this is going to show me immunizations that may not be in my EHR because, of course, I did not administer them, but Rainbow, God bless her, has received 3 doses of COVID. One is probably, well, she was born in 2006. One's probably not appropriate. So I'll highlight one last report and then I'll take some questions. So we have a family visiting report available, and this will show the practice, how many kids are participating in family visiting program. So if I wanted to start at 2 months and go all the way up to maybe 24 months and generate my report, it's going to show me the children that are participating. And what I can see is the child's name, the program that they're included or involved in, the agency that's working with the family, and are they active in a family visiting program. So now if I said, gee, I didn't realize Schroeder was involved in Healthy Families America, I'm going to pop over and take a look at that. I can highlight my KidsNet ID number and come over to search and pop in that number and take a look. So here's Schroeder, and if I wanted to see, okay, there's that first connections. Currently enrolled in skilled nursing. So we don't have any Healthy Families America data displaying in our train environment as of yet. So that was probably a bad example. So I apologize, but I'm glad we landed here on Schroeder because he has early intervention information. So just to show you a little bit about what that page looks like, we can see the referral date. If he had had the date of the evaluation, that would be listed. IFSP date stands for Individualized Family Service Plan. And if he had been discharged, that discharge date would be listed. Parents agree when they're participating in early intervention as to whether or not they will share their information with KidsNet. And Schroeder's family had checked that agreement to share their information and make it available in KidsNet. So I just want to touch upon that, that sharing of information for a moment. And I'm going to go over to the Department of Health's page for RICAIR. So this is our RICAIR page. And what we spoke about early on is how all children are included in KidsNet at birth. And parents are informed that this is going to happen through a brochure that they receive multiple times, first in the OBGYN office, then in the birth hospital, and shortly after the baby goes home. There's a piece about all of the newborn screenings that will take place and a piece about KidsNet. Parents do have the right to block their child's information, meaning all of the screening information, the lead screening, etc. And if they choose to block the information, if I were a provider's office or a school nurse teacher and I tried to access the information in KidsNet, I would receive a message back stating access denied. Now, when we made the registry available for all ages, we needed to include legislation. The legislation stated that we needed an option that allowed for users or individuals to remove their immunization information if they so wished. So when we talk about these options concerning KidsNet and or RICAIR, the option to remove data only is pertaining to the immunization component. All of the other information that's included in KidsNet and or the health information system remains in our protected database. If a parent chooses not to share that information, then only a handful of folks at the Department of Health would have access to it, but it would remain available. Users such as adults and parents of children, if they opt to block their children's immunization information, they can continue to do that, or even their own. If they wish to delete their own immunization records, they certainly can do that, and they can even delete their child's immunization information. We discourage that because once it's gone, it's gone. But that is their option. And they can also then go back in and restore, which would allow their provider. The provider is always going to send the information to KidsNet. The difference is that if there is a block on the individual's record, we won't take that information in. So I'm going to stop there and answer any questions you might have.
Hi, Janet, I actually have a question. Do you find that smaller practices have trouble with this? I just know previously I worked with smaller practices who didn't have an EHR, and they had a lot of trouble submitting things. So I'm just wondering what you've experienced with that.
So Jenna, I'm having a little bit of a hard time hearing you, but so smaller practices having a hard time submitting their data?
Yes.
Yes. Especially more so for adult practices. So I just want to make a distinction that if an adult practice is not using an EHR or does not have the capability to send their data via the HL7 process, then we are not able to take in their routine immunizations into KidsNet, because there was a decision made simply because we don't have the staff available to continue to data enter immunizations, because it's very time consuming. It's a very manual process. So when the registry went from just under 19 to include all ages, that decision was made. Now for COVID vaccination, they made a system. A system was developed called PrepMod that is separate and apart from their EHR system, and it utilizes different technology, and they were able to use PrepMod to send their data electronically and within 24 hours, which was of administration, which was a federal government's requirement. They can still, adult practices can still utilize the system, see the information, but if they don't have the capability to send their information, then unfortunately we won't have the individual's documentation.
Thank you.
On that note, I'm glad you brought that point up, Jennifer. We are accepting immunizations from adult practices. In most cases, it is including their recent immunizations, meaning anything that, if I went to my provider and I received Tdap or a COVID vaccine booster, or even a shingles vaccine, of course, that data would come if they were utilizing the proper systems. It's also dependent on the system that they are using, the vendor that they're using, as to whether or not the information that's already existing in their EHR concerning my immunizations being, if I've been with that practice as an adult for 10 years, and 10 years ago I received Tdap, as to whether or not that historical data will come. Now, lots of people call the Department of Health thinking that we have their immunization records from when they were a child. We generally will only have an individual's previous immunization records if they were born from 1997 on. In some cases, if they are under 30 years of age, we might have some historical data. But if an individual is my age, of course, we're not going to have their childhood immunization records. So that's unfortunately the case. But because of KidsNet, when those 25-year-olds age, as they ultimately will, they'll have a full immunization record available.
That's great. Thank you.
Sure. Does anyone else have any questions? I just want to give a shout.
In the chat.
I'm sorry?
There's no questions in the chat. Just wanted to let you know.
Okay, thank you. And I just want to give a shout out to Kenya Vasquez, who's been helping tremendously with our COVID vaccination inquiry line, who is on the call right now. Thank you, Kenya.
Great. Well, if no one has any other questions, I just want to thank you, Janet, for joining us and sharing more about your program. It's been really great to hear about it. Thank you.
Sure, my pleasure. Hey, everyone have a great day.
Thanks, you too.
Bye-bye.